can't breathe, nothing else matters. If somebody's airway is obstructed from cancer or even non-cancer causes and they're literally breathing through a straw, I could open that up and get them breathing better. And it's just a fabulous part of my day when somebody's struggling to breathe before the procedure, and after the procedure, they can take a deep breath.
Figuring out what's in those lymph nodes has always been a struggle. And it used to be we could only do it through invasive techniques. We'd actually make an incision, dissect down to the patient's windpipe, and pluck the nodes off. Now we can use robotics to either make a small incision and pluck out those lymph nodes that way, or we can do it bronchoscopically to sample those lymph nodes with a needle. There's no incisions for the patients. They may have a sore throat, but they are getting a diagnosis, and we're able to appropriately stage their cancer in a minimally invasive way.
We literally are on the cutting edge of not only medical and radiation treatment, but also surgical treatment for the diseases of the chest cavity. The bronchoscopic robotic platform is huge for us because it just adds one more armamentarium that we have in our, pocket for diagnostic and therapeutics. This is improved ability to navigate to and biopsy lesions in the lung. So I think it really does kind of not only advance the care, it reduces the risk for patients undergoing biopsy because it's a lower risk procedure with a higher overall yield.
It's extended our hands and our minds and the abilities for us to interpret what we're seeing in front of us and then deal with it in a less invasive fashion than we used to have to in the past. I think it's also easier for the patient because you come and get it done and you go home the same day. So it's really opened the doors to allow us to treat more patients in an efficient and helpful manner.
When you put the patient first, everybody wins. It's one of the things that makes the care at Dartmouth so wonderful is that as the technology advances, we take advantage of that technology to improve the care of our patients.